Perfect. All right. Thank you all for joining us. Welcome, welcome. I love to see all these people here. So my name is Neha Bhatnagar. I'm one of the co-chairs for the AAEM Wellness Committee. And thank you all for joining us today as part of the Stop the Stigma EM campaign this entire month. This is our AAEM's contribution is this webinar discussion with our esteemed panelists to talk about the invisible work of women in emergency medicine and its impact on our mental health. So a big topic, but we've got some great things we want to talk about with you today. And thank you for joining us. I'm thrilled to see you all here. Please feel free to use the hashtag StopTheStigmaEM, hashtag AAEM, SAEM. I put some resources in the chat there for you too if you'd like to spread the word. The recording of this will be posted as well after the lecture, but I love that so many people have joined us live today. So I'd like to next introduce our panelists. So let me pull these little bios up real quick. All right. So first of all, alphabetically, we've got Dr. Kimberly Brown, who is a member of our AAEM Board of Directors and serves as the board liaison to the ultrasound and locums tenens section. She is also the host of the AAEM JEDI, or Justice, Equity, Diversity, and Inclusion Initiative podcast. Dr. Brown is a locum tenens emergency physician practicing for over 5 years, an entrepreneur, a business coach, and a business coach for historically underrepresented doctors. When she's not on a plane, you can find her curled up with a good podcast or enjoying her view of the beautiful Mississippi River from her balcony. Well, thank you, Dr. Brown. All right, next we have Dr. Mishta, who is an assistant professor of clinical emergency medicine in the associated faculty of the Perelman School of Medicine at the University of Pennsylvania. She is the assistant medical director and rapid response director of the hospital of the University of Pennsylvania as well, in the Cedar Emergency Department. She is the chair of the AAEM ACCME subcommittee as well. So thank you, Dr. Mishta. We have Dr. Lisa Moreno. Very excited to have you here with us. She is our immediate past president of AAEM, like the entire AAEM, the first woman president, a tenured full professor of emergency medicine, and former dean for diversity and inclusion, and is widely published and grant funded in diversity, trauma, and viral diseases. Thank you for joining us. And last but certainly not least is Dr. Kat Stefanos, is faculty at the University of Maryland in Baltimore, where she practices emergency medicine in the adult and pediatric emergency departments and is assistant clerkship director. She completed a combined training program in pediatrics and emergency medicine and spent 6 years at the University of Rochester in Rochester, New York, before returning home to her hometown of Baltimore, Maryland. She is mother to 3 children, who she refers to as her medical student, residency, and attending babies, who keep her very busy when she is outside of the clinical environment. So thank you all for joining us. I would like to first get started with a little icebreaker. So what is one seemingly small but specific task that you are asked or expected to do at work or at home that your colleagues or counterparts or partners are not asked to do, or that is not explicitly part of your job or duties? So I'll take an easy one. So patients that ask us for a cup of ice or a warm blanket, I'm happy to do it. It takes 30 seconds to do once, but when you're asked 6, 7, 8 times, that adds up. And in that time, you could have, read an EKG, done a procedure, finished a note, in all of that time. And not all of my colleagues are asked to do that as well. So I'll open the floor up to there, but we'll start with our panelists.
I'll go first. So in our hospital, the environmental services don't strip the bed, and it's normally a nurse's procedure. And I'm often sitting in the doctor's station and very often asked to do that task by many people. So, sometimes if I'm not busy, I'll help out, but it's definitely not part of my regular job description.
So I think that's a good example. I've been asked to mop up vomit on the floor because people assumed I was a housekeeper. Um, I will tell you a story. When I was a surgery resident, a patient wet the bed, and I put the patient in a chair and I was changing the bed. And the chair of surgery came walking down the hall, and he called me out of the room, and he said to me, "You need to understand something right now. I pay you $45 an hour," which at that time was what residents allegedly got based on a 40-hour week, which we were working 120 hours. But he said, "I pay you $45 an hour out of the department budget, and I pay the housekeepers $12 an hour out of the department budget. You need to earn your salary by doing operations and seeing patients. And I'm not saying you're too good to change a bed, but I'm not paying you to change a bed." And I think that's part of the whole concept of looking at ourselves from a standpoint of wellness, and from a standpoint of self-esteem, and from a standpoint of, the work environment becoming overwhelming. There are certain things that we've been hired to do, and we need to do what we've been hired to do, and we need to do what we've been trained to do and what we've been prepared to do. The flip side of that is that when I was an emergency medicine resident, we had a female program director, and she created an environment where we really were a team. So anybody who wasn't doing something did whatever needed to be done. And so if you were sitting there and you weren't writing a chart, you stripped the bed that had just been vacated. If you were sitting there and you weren't, on the computer, or weren't doing a chart, then you were the one who helped the patient walk to the bathroom. But nobody was ever expected to do something because of their gender, or because of their race, or because of their ethnicity. So those are two kind of ways that I've been taught to look at it throughout my training.
Thank you. Thank you. All right. So a more broad question. So what does invisible work, the term invisible work, mean to you? How does it affect certainly your mental health, your well-being, your wellness? How does it affect your concentration, your efficiency, productivity on shift? And beyond that, since we aren't just all clinicians, and our whole lives aren't just about our job, how does it affect your job outside of work? How does it affect your creativity, your sense of purpose, your connectedness? That's a big question.
I'll say, to me, invisible work is all those extra things that we have on our plate. For me, being a mom as well, I am tasked as the keeper of all things. I'm supposed to know where every single item in my house is, as well as the entire schedule for the every day of every week. My husband is incredibly helpful. He was a stay-at-home dad until 2 months ago, so this has been a major adjustment over the last 2 months. But and he did a lot of things, but I still had to write the list of things that had to be done, which is just a little extra task, right? That's just one more thing on my list of things. And I think it does take a toll, right? Like, to be in a job where I spend the whole day making critical decisions, my preference is to come home and make no decisions. Like, I don't want to make a decision about what we're having for dinner. I would like somebody to just tell me what we're having for dinner. But those little things, right, they add up. And it does take away from time to do other things and focus on what I would like to be doing on my free time.
Yeah, I just like to second what Kat said. I'm not a mother yet, but women, we're always asked to run the show and to hold all of the secrets and to do all of the things. So that's something that I think plays into my life as well too. I have 2 other businesses that I'm running, and still I feel the responsibility to be the customer service department, to be the sales department, to be all of those different things. So one thing that has helped me to get rid of some of that invisible labor, not just in the emergency department setting, but just in life, is just to ask for and to receive help. And what I mean by that is that I have a housekeeper, I have an assistant that helps me, I have an accountant that helps me to keep all of my numbers and everything straight. But so many times, I think women, and honestly, more specifically, women of color and Black women, are always asked to shoulder all of the burden. We're expected to do it. Oh, you're so strong. You can do it. You've got this. You're not stressed out. And so I use that knowledge to kind of mitigate holding that responsibility of the invisible labor by just honestly asking for help with that. I do think invisible labor for me shows up in the ED, specifically when I walk in the room. It's very clear that I am a Black woman, and statistics show that less than 2% of all physicians in the United States are women of color. So when I walk in, it's automatically going to be an assumption: am I the housekeeper? Am I the nurse? Am I anybody else other than the emergency physician? So sometimes there is a unspoken conversation between myself and the patient, sometimes myself and the staff, because they have to recalibrate what they think that, or who they think Dr. Brown is going to be when they walk into the room. A lot of times as a Black woman, I think society teaches me that I have to be smaller or not be my entire self. And that is something else that I'm constantly having to check in my head. Am I too much for somebody? Does somebody not understand where I'm coming from? All kinds of different things. And also too, sometimes people are just flat out ignorant, and they say things that they don't know is hurtful or racist or harmful or prejudiced. And so also then having to do the invisible work of being an educator of culture and race and how to do that, all while I'm still just trying to do my job. So for me, invisible work comes up not only just as, yeah, patients ask me for blankets and for ice and to strip the beds and things like that too, but there is definitely a racial and a cultural extraness that I have to add on to things a lot of times.
Absolutely. Thank you for that. And not only are you thinking, how am I going to help this patient? I'm also going to think, you're also thinking about, or I'll speak for myself, I'm also thinking about, how do I make sure I don't come across as mean? Or how do I make sure I'm giving feedback to this resident in a way that they're not going to think I'm condescending to them? Like, I'm not just thinking of what it is I'm actually doing. I'm thinking of, how is it going to be interpreted? How is this going to make me look? How is it going to make them feel? Absolutely, all of that.
So, Dr. Brown touched on a lot of important concepts about invisible work. And I was asked to be part of this podcast from a standpoint of being a senior leader. And so one of the things that I try to think about as a leader is making sure that everybody on my team thinks about invisible work, the kind of things that both Dr. Stefanos and Dr. Brown talked about. How did that meal get on the table? All the grocery shopping, the meal planning, the cooking, it's on a clean plate. There's a napkin next to the plate. How did all this happen? How did this child actually get to school? So they're wearing clothes. They're wearing clean clothes. Someone washed them. Someone put them on the child. Somebody made sure the child's lunch was packed and book bag was packed and provided transportation. Like, how did this happen? And I think that's where we, not just other people ignoring our invisible work that may be due to our, or speaking to Dr. Brown, how did that podcast actually get on the air? What happened? It didn't just drop out of the sky. And I think it's also helpful for us to make sure that our trainees understand the invisible work of others. This happened, in a very pronounced manner during COVID, when I watched housekeeping people who are predominantly people of color and who are predominantly people who have a lesser health literacy than we do. And I would tell the residents frequently, do not forget to say thank you to these people, because you can do your job because they are protecting your health and safety. They don't really understand how COVID is transmitted. They are terrified of contracting COVID from the vomit and piss and shit and everything that's on the floor in that room and on the bed in that room. And yet they go into that room and they clean that room. And because of them, you're not going to get exposed to COVID, and the next patient's not going to get exposed to COVID. So I think we need to create this culture where our invisible work is seen and appreciated, and where we teach others to don't just walk into that room and think, you know, I'm seeing the next patient. How did that patient get into that room? And how was that room prepared for the patient to be there? And I think that is a really, you know, again, creating a culture where we appreciate the invisible work of others and where we point out the invisible work that we do and the invisible work that some of the people on our team also do.
Thank you. Yes. Dr. Stahl, would you like to talk?
Yeah, hi. So one of the things I wanted to mention is being aware of things that you're told might be necessary or helpful for your career, but really you have to figure out, is this actually going to help me? Is this going to be worth my time? Because you might be asked to be on a bunch of committees or participate in some other capacity. Like at one point I had a salary where you would get extra pay for doing different things, but it was really unclear as to what you know, what was paid and what capacity or what was rewarded more. And so, you know, I would sign up for things, but I had no idea, you know, is this actually helping me? Is this something that's going to contribute to my career or advancement? And, you know, it's just, you got to be careful that your time is valuable. And is this a valuable use of my time to maybe sit on a committee? Maybe it's only, you know, an hour a month, but that's an hour that you have to spend at a place that's probably not at your house. You have to get there, you have to take the time off, or, you know, work your schedule around it. Is this worth it for you to take that time away from other things?
I think that's an excellent point. And I think that brings up something that I thought that I said before, but I'm just going to say it again because you double tapped on it. It seems like women are always expected to be the ones to volunteer to be on the committees and to be the one to step up. And I think also more specifically, if you are a resident or a person of color, and you are one of the few and only, then you're even more expected to stand up, to be the representation, to be the diversity. And that is a lot of time consuming effort to, you know, go to the meetings, to participate, do any subcommittee things. When do you have time as an attending, as a resident, to just sit and enjoy yourself, even just have a few moments to yourself? I think our society also makes us feel bad and not highlight this invisible labor because it's oftentimes, of course, as we know, unpaid, like Lisa brought up, but it's so integral into things. And it just seems like, well, women are naturally doing it. And so we seem like we're okay. So let's just keep on like just expecting the women to just do it. Whereas the same expectations, I feel like, of our male colleagues is not the same. They're not automatically picked to just, you know, volunteer their time and their energy on committees a lot.
I think also, like, as in a position of management as like the assistant medical director, I'm expected to wear all these hats and be very PC and be like the punching bag. But also, I think more people are willing to like open their feelings with me because I'm a female, which makes my job even harder. And I can't express any frustrations that I have. I still have to maintain a certain, you know, perspective and appearance, which I don't think are expected of my male colleagues. And then back to what Dr. Stahl said, one of the best advice I ever got was I was going for a position that was not going to give me any buy down, was not going to pay me more. And my boss was like, you need to only take positions that will give you buy down or pay you more money. There's no reason that you should be doing anything else. And I think that's really important to hear.
Yes, thank you. The emotional work as well, that is absolutely expected. Nurses coming to us with problems that they want to talk about that aren't necessarily even related to the actual patient care, or having personalities that conflict, and somehow we're the ones that are meant to fix it because we are the mothers of the department, or we are the women in the department, and we are the ones that are supposed to go help with those things and put our emotional and mental energy outside of ourselves and our own goals again. Absolutely. And Dr. Stahl, thank you for your point and your share. It kind of brings me to one of my next questions is, if we didn't have to do some of this emotional work or invisible work, excuse me, what would you do with that extra time and that extra energy that you had? What else could you be doing that you haven't been able to have the capacity to do now because of the work that you're expected to do? And Dr. Sorry, I'm going to say your name wrong. Kazir, is that right? Or I'm not sure. Go ahead.
It's Kazir. Yeah. I was just going to say that I identify as a burnout survivor. I actually burned out early in my career when my children were little, and was able to come back to practice again in a much more healthy and sustainable way. But one of the things that contributed to my burnout was a feeling of loss of control, like I had to do all these things. And when I came to the realization that really each one of these things is a choice, I don't have to do all of these things. The truth is, I actually enjoy doing birthday parties for my kids. I enjoy buying their clothes. I enjoy talking to the nurses and helping them. It's when we do things that we feel are expected or other people will think ill of us, that's where the problem comes in. And when we can claim our own autonomy, our agency over that, and say, I am choosing to do these things. I will choose the things that help me to be healthy and happy, that help my family be healthy and happy, the things that create meaning for me. That is where we can combat this problem, because the invisible work will always be available to us if we choose to do it. But we really don't have to do it.
Yes, absolutely.
That's a huge point. That's a huge point that you made, and you opened a big box, I think, that Dr. Mistal kind of started to unpack, and that is the concept of what is expected of us because of the fact that we are women. So you like to do your kids' birthday parties, but normally that just sort of defaults to the mother. Even in two-career families, studies have shown that even when a woman is married to a fellow physician, that physician still does not, because now that physician understands the demands on you at work, really understands them, and yet that physician does not step up. 69% of the domestic tasks in households with children are deferred to the mother. In heterosexual households with children are deferred to the mother. And so that concept of choice, and Dr. Mistal also brought up the concept of people come to her and they dump on her, and that's my word, not hers, but people dump on her about their problems at home, their emotional issues, because she's a woman and she's expected. So it comes down to expectations. And I think, again, what we need to start to do is to reframe the culture that we work in, so that what I have learned to do is to say, if I am the person of whom this is expected all the time, and if I am the person who's getting emotionally dumped on, and nurses will come to me and say, I'm coming and talking to you about this because you're nice. It's about Dr. So-and-so, but he's not nice, and so I can't talk to him. So the issue then becomes, then he is not doing his job. Dr. So-and-so is not creating a culture of open communication. He is not creating a culture of bilateral communication. He is not doing his job. This needs to show up in his performance evaluation. this needs to show up, you know, his whoever the chair or the dean or whoever is over him needs to understand that this is something that he is not good at and he needs to work on, because I should not be doing part of his job because of the fact that he's not perceived as nice or communicative or open or willing to listen, et cetera, et cetera. This is now a skill that this doctor needs to learn in order to be more effective in his job, rather than me having to take on part of his job. You know, and the same thing at home, right? You want to do the birthday parties, you want to buy the clothes, but you maybe do not want to clean the kid's room, or maybe you don't want to be the person who has to stay home on the day that the kid is sick and has to stay home from school. So I think we need to be more assertive, not aggressive, and not, you know, as was said earlier, not mean, but we need to just be more assertive and say, this is the work that needs to be done. And if I'm performing the job better than my male counterpart, then my male counterpart needs to be given the skills and abilities to step up to the plate and do his job in an effective way, so that I don't have to pick up the slack.
Dr. Brown?
I agree with what Lisa is saying. I just want to, as I'm sitting here, I'm just going back and just thinking about some things. A lot of what we consider invisible labor and invisible work is honestly what we as women are built for. We're built to create and to receive and to nurture and to support people. And so a lot of the things that people are asking us to do is some way an extension of that, meaning even if it's a blanket, a cup of ice, you know, a listening ear, most of the times people go to women for that, because that is our natural skill set and that's our natural ability. And I don't think that we should 100% downplay and just scourge invisible work, because I think within that is a piece of our power as women. And more specifically, I think that ties into the fact that there was a study that came out a few years ago that says that most patients have better outcomes when they are treated by women physicians, and they feel more open and connected to their woman physician if they have one. So they, like I said, they overall are healthier, because a lot of times we hold space for them, we listen, we can connect when something isn't always matching up, because we have a natural intuition that another gender does not always have, or it takes a little bit more time to cultivate. So I wanted to just say that, because I think there's a moment of empowerment here, that there is some things that we are asked to do that not everybody else is asked to do. But sometimes if we look at it in a different way, it is because we are the only ones that can really offer that magic in that space. So I want us to be able to celebrate that as women, we do offer something different. This is what the healthcare system has honestly been needing. It's been very patriarchal and very cold and strict and rigid for some time. There needs to be more softness and more intuition and more nurturing brought back into it as well too. So I just thought I would bring that up.
Thank
I
you.
think that, oh, sorry. I don't know how much of that is nature versus nurture, because we've been raised and taught societal expectations to behave like that. And sometimes, you know, if it's crazy and you've got multiple crashing patients or something, you can't sit there and be the one holding their hand and providing a listening ear. Sometimes you have to be like, this is what I need to do. I need to move on. And then a patient might take that in a really bad way coming from a woman. Whereas if you're a man and you say, this is what I need to do, they'll just be like, oh, okay. And, you know, you're kind of running into, you know, gender expectations, and do you fit the gender norms, and are they going to hold that against you as well because they expect something different? And sorry, I have to actually leave for a meeting, but I also wanted to mention something I heard early in my attending career from Amalma too, in one of his presentations, was anytime you say yes to something, you're saying no to something else. And that's usually your family. And I've tried to take that to heart. And my husband, who actually does most of the stuff around the house, is always telling me, stop picking up extra shifts, because I've tried to be the person that you can come to and say, hey, let's trade a shift or whatever, because I know that I'm going to need to trade a shift sometime. So I try to be the person that somebody's going to say, oh, you know, maybe she'll take my shift, and then they'll be willing to extend that courtesy later. But lately it's just been stop working so much. You don't see your kids and they need to see you. So anyway, I just wanted to throw that in before I have to go.
Oh, absolutely. Thank you. And we absolutely understand if we have other meetings, but thank you for that point. That is very important. And going back to the topic of choices, and you actually do, it is empowering to have choice, even though you don't always feel like you have a choice in the moment. But and then one of the other things too, Dr. Brown, about that study you mentioned is I love that, you know, we talk about soft skills and you know, nature versus nurture, but with women, and I love that study took our soft skills and then gave us hard, clear, objective results that were actually, these patients were actually better for our soft skills. It wasn't just that, oh, they liked me more. Oh, that's great. But their outcomes were actually better. So I love that. One of the things I wanted to talk about, and we've touched a little bit on this, but have you, in your careers, or panelists, or anybody, have you delegated or tried to offload some of these, or even just declined, refused some of these invisible work tasks? And how did you do that? What kind of response did you get from that? Was it having housekeepers, or was it just refusing? What were your experiences with that? Because I am a young attending, and I am definitely in the mind space of saying yes to a lot of things because I'm eager and I want to, you know, show that I'm eager, but then I stretch myself too thin. So I would love to know the answer to this. How do you say no?
So I think Dr. Stahl hit on something when she said that we are judged differently than males are judged. So if you have a patient who you just went in and told them that their child did not survive a gunshot wound, and all of a sudden the nurse comes running in and says that, you know, somebody is in VTAC, or there's a, you know, an MVA coming in, and you have to leave. And people are like, that heartless bitch, she just walked out of the room. Whereas, you know, someone may say, oh no, well, the male doctor, oh, he's so important, no, I understand, you're needed. So again, the whole concept of what do we do, Dr. Bhatnagar, in order to make sure that the needs are met and not necessarily all met by us? I think number one, we need to have more females in leadership positions, because women do understand those things. Number two, we need to change the definition from soft skills to hard skills. This to me, I always say that and I'm proud of the fact that AAEM also values this, and it shows in the way the oral examination is done. It is procedural skills that we are experts at. It is a medical knowledge base, and it is communication skills. Communication skills are just as hardcore as anything else, because I could be the most brilliant physician on the planet. I can make the diagnosis within 2 seconds. I can know the optimal treatment plan, the best antibiotic, the most incredibly effective intervention. And if I cannot convince the patient that I love them and care about them and want them to get better and understand their socioeconomic status and whether they can fill a prescription and whether they can get a day off to show up at the clinic or go to or have their operation done, that determines the outcome of my patient. That determines the outcome just as much as whether I made the right diagnosis. It's not a soft skill. It is hardcore. It is hardcore to be culturally competent. It is hardcore to be compassionate. It is hardcore to be able to communicate with patients. And so what do we need to do? We need to make sure that there are enough social workers in the department so that when I get called for the ventricular tachycardia, I don't leave that mother who I just told that her son failed to survive a gunshot wound, that I don't leave her crying all alone by herself in the family room. We need more social workers. We need more pastoral care. We need, somebody put in the chat, we need more housekeepers. Definitely. You're complaining to me that I'm not turning over rooms fast enough, but I can't get the rooms clean. right? Patient satisfaction is not what it should be because the patient can't get a glass of cold water, because they can't get a blanket, because the stinky vomit is not being cleaned out of their room. So we have to advocate for those support services that our patients need. And we also need to make sure that administration knows, all they care about is money and the patient satisfaction scores, customer service scores. So this is what we need to go to administration for. You want more money? Help me turn those rooms over faster. You want higher patient satisfaction scores? Get pastoral care, get social workers, get housekeeping, so that the patient satisfaction scores will go up. So I think it's down to more women in leadership positions, redefining what are soft skills versus hard skills, and getting administration to give the support services, because it'll help them make more money and get higher patient satisfaction scores.
Absolutely. Yes. Dr. Brown, I see your hand up.
First of all, amen to all of that. Amen to all of that, especially at work. But I want to just double tap again on something that I said earlier. That's definitely good when we're at work in the emergency department. That's the structure that we're working in. I think sometimes we forget that we're our own individuals of ourselves. So going back to Neha, your original question, how do you say no? I said in the chat, no is my favorite word. So I don't have any problems with saying no. But to back it up to just say no, this isn't a dare class. I think it's important for you to have your own mission and values and what you find to be important first. If it is time with your kids doing the birthday parties, if it is decorating your house, if it is just having all the time off that you want to do whatever you want, whatever that looks like, that's what when I left residency, I really just decided, what did I want? What did I want my life to look like? How much did I want to work? What type of environment did I want to be in? If I was going to be on a committee, what type of committees was I going to spend my time on? So once I got clear about what I wanted first, and then opportunities started to present themselves to me, if it didn't line up with my rubric of what I said that I wanted in my own life, then I just said no. It's easy to do that at that point. But I think taking some time in order to really fully decide what you want is very important. I'm so glad that Laura raised her hand and kind of chimed in earlier. I also experienced burnout during COVID and pretty early in my career as well too. And I think that's what kicked off this thought process, is because I did feel like I had a lack of control over everything. My schedule was a mess. I was pulled in different kinds of ways from committees. I felt like I had no control over my life anymore. So it was when I, again, prioritized what I wanted, which is time off, the ability to make X amount of dollars per hour, the ability to take care of my mom and pay off some things and do all those other things. Then it was a lot easier to say no from that standpoint. So if you have any question, check in, what do you really want first? And I think a lot of times we think that we don't know what we really want. So just really take some time to sit and to think about, what do you want your life to be and how do you want it to look? And if anything doesn't align with that, then it should be a no-brainer for you at that point.
Thank you. Yes, it starts with knowing yourself and knowing your goals and your mission, and then saying no to something that doesn't align with those things becomes easier. Absolutely. Dr. Kassir?
I love what Dr. Brown said, and I just wanted to add that it becomes easier once you realize that you are better for the people that really matter when you protect yourself from things that don't matter. And that your ability to be able to function in this, arguably one of the very most demanding careers in existence, we have to get good at protecting ourselves from things that don't matter so that we can be there for the things that do. And no can be a very loving thing to say when it's to things that are going to affect the rest of our lives in a negative way. So and getting to the point where we realize that other people may have expectations of us that don't align with our values, and that's okay. That's them. What they think about us does not matter in the least. What we think about us at the end of the day and the end of our lives and how we lived, that's what really matters. So we can just let other people's opinions of us that's okay. Bless their hearts that if they want to, think ill of us because we're protecting ourselves.
Absolutely. I love the phrase, what other people think of you is none of your business. I love that. Dr. Mistal?
Just with going back to saying no, I think earlier on in your career, it's a lot harder to say no than as you're getting more advanced in your career. And having knowing exactly what you want or where you are, for me was really hard in the beginning because I didn't really know what I wanted or where I wanted to be. So in the beginning, I did say yes to a lot more things just to give myself opportunities. And then as I kind of figured out what I was doing and I was saying yes to too much, then saying no was a lot easier. And I think really knowing your worth is really important. Your time is valuable. Your skills are really important. And what's unique about you, don't give that away. People, your time is valuable. You deserve to be paid for it. You deserve to be recognized. And that's really important.
Absolutely. Absolutely. Dr. Stefanos? Oh, you're muted, Kat.
I agree completely. I think also one of the things that I always reflect on is through all of training, through like going through medical school, through getting to medical school, through going through residency, you're not really given opportunities to say no if you want to achieve the goals that you set out for yourself. Like, that's how you get where you get. And then you get out into the real world and even a little bit in residency, but it's still hard to say no in residency. You get into the world and you actually have that ability. And I think we're not trained well to say no because we've gotten into this habit of we have to say yes to get to where we want to be. And, that was something that really dawned on me. I should be better at saying no to certain things or maybe certain people in my life but at the same time, I feel like when I said the biggest no of all, which was like, no, I'm not going to work here anymore. That was a very freeing experience because it wasn't working for me. Like, I love the people that I left in Rochester, but my whole family, literally everyone, I have 22 cousins. They're all here in Baltimore or nearby. Everyone is here. And I was living, and my husband's family's here. So we had left everyone to try and experience something different. And it just wasn't working. And once I finally said that no, there was this like weight lifted from me. And one of the things that I've tried to instill for residents is also, and anybody I'm mentoring is, do you want to actually do this? Right? Say it behind closed doors, right? So they're not in front of the person that they just said yes to, but is this really something that you want? And like one of my mentees sort of became in charge of getting diverse residents to come to Rochester. And we had this conversation. Is that what you want? Like, do you want that role? Because it kind of got put upon her, but, and she did, but she wanted somebody to ask that question, to really ask if that was something she even had an interest in, or if it was something she just got assigned because of who she was. So that's our role as a mentor going forward.
Absolutely. Modeling that ability to say no to things is also important for us. And I very much relate to what you were saying about going through training where we're saying yes, and we're ambitious, and we're all very highly skilled and highly trained, and we got where we are because of our ambition in some ways. And so to get out into the world and be able to redesign what we want from our lives is a skill we weren't taught and we weren't practicing, or at least I wasn't. Dr. Kuja?
I think that no can take many forms and shapes. No, it doesn't work for me, period. No, it doesn't work for me right now. More of yes, I would love to, but this deadline doesn't work. This timeline doesn't work. And kind of piggyback on the sponsorship piece is that sometimes somebody presents an opportunity to you that doesn't work now or doesn't work ever. But then you can take a moment and think of somebody else where you're like, yes, I'd love to, but I can't. However, so and so would be interested, or so and so would be a good fit. And I think that reframing the no into all of these other options allows these individuals who are coming to us with opportunities to continue to come back with these opportunities. And also it's giving them a little bit of an understanding of whether it's just the timing that doesn't work, or is it a different part of that arrangement that doesn't work, and therefore not close that door, because I think that's our.
Absolutely. Thank you.
I love what you just said, Dr. Kuja, and I think that's critically important, especially in the beginning of your career. You, someone mentioned that, I don't remember who said that in the beginning of your career, if you say no too often, you're not going to be asked again, because you'll be seen as a person who, who says no all the time. And all the time may not be accurate, but if that's the perception of your chair or your dean or your ED director, then that's the perception. So I love the concept that you brought up, and that's something that I recommend highly, is to also be a sponsor for other people. Say, you know what, I'm hearing what you're asking me to do. I think it's a brilliant idea. I see that the project is really important to you, and I think that so-and-so might be better at doing it. Or the timeline thing, I'm not able to do it right now, but if you asked me to do it in January, I would be able to do it then. The other thing is also bargaining, and this is something, bargaining and negotiating are skills that women as a rule do not excel at. So what you can also do is say, I see that this project is critically important to you, and I can see how it would be critically important to the School of Medicine or critically important to the department. Right now, I have too much stuff on my plate to do it. So would you consider, I mean, you can say something like, I'm taking my son on, college visits because he's graduating from high school. So would you consider providing a stipend for this job so that I don't have to pick up extra shifts to cover that expense? Or would you consider, since I have this finite amount of time to devote to work, would you consider dropping me down one shift per week for the next 3 months while I complete this project that's very important to you, and that you feel that I would be the best person to take on? So doing these negotiations and bargaining, are you going to give me extra money? Are you going to reduce my clinical hours? How can we get to yes? How can we make this happen? Because your idea is brilliant, and I think it's important, and it needs to be accomplished. So how can we get to yes? How can we create an environment where I'm not going to be harmed by doing this favor for you, or doing this project with you, recommending someone else, negotiating the timeline, or absolutely negotiating the money? Give me less clinical shifts, give me a title, give me more money.
Absolutely. And just not being afraid to even talk about the money, the business side of it, and advocating for yourself for that. Before we run out of time, we're about 10 minutes left. I love all of this discussion. I wanted to pose one or two more questions for the panelists and for the group in general. So what is one or two actionable ways that an individual person you work with or in your family can help to lighten your invisible workload? So individual people. And then what is one or two actionable ways that an entire system could actually help to lighten your workload? Because we know it's not just about individuals in our environment, it's the entire system we work with sometimes. So just a couple of examples.
People have already talked about hiring non-physician healthcare workers to do non-physician tasks. So making clear that your department, your hospital, your medical school understands that social workers, pastoral care, and housekeeping are critically important to patient satisfaction and to running an efficient and lean machine in the emergency department.
not only just that, but also CNAs, paramedics, techs. We need all of those people to, help to change the beds, help change patients, actually do the EKGs that we're ordering, all of those things too. I know, of course, that's what you meant, Lisa, but just even nailing it down even further. I think it's also too remembering we are the physicians. We are the ones that need a lot of support. So remembering that and just not being afraid to apply that to our home life as well. Whether that is someone that meal preps for us for a couple of days a week, whether that is someone that can walk our dog a couple times a day so you have some time to just breathe and to sit and to rest. Maybe hiring a personal assistant for 5 hours a week to run the errands, open that pile of mail that has been piling up on your dining room table, or do anything that is just honestly just going to take an extra step. Asking for and receiving that help for me, even as a single woman, has been very, very helpful and powerful. And it gives you more opportunity to have the time to do the things that you want to do, or to just do nothing, which we need that as well too. That's okay to just sit and do nothing. We forget that that's okay.
Yes, so many creative ideas and thoughts come from boredom and doing nothing. And if we don't have the time to do that, how much creativity do we get to really have? So what other thoughts do we have? I'll also ask our panelists, since we have a couple minutes left, is there one special point, one particular point you want our listeners to take home with them today? So many great ones have been given, but if you had to pick one.
Say no, but I'll modify it to say no maybe when you're like a second or third year attending. Yes.
I think really know your priorities. Take your time to figure out what those are in your life and what means the most to you. And then make sure that when you're saying yes, that it's aligning with those. That's critical to making sure you're happy in what you're doing.
Say know your worth and recognize all the little things you do. And some of the things I do is I even write all the stuff I do down just to remind myself of all the things I've done. So
I love that. I do something similar. We all have our to-do list, right? The things we haven't done yet. But every now and then write a list of the things you did do, the things you actually have done, and it helps with your brain to actually see the things you have done, not just the things that are missing. All right. Well, I want to thank you all again sincerely for all of this discussion, personally, and then of course as the Wellness Committee co-chair here. Very thankful for all of our panelists and for our group members, our audience members who participated as well. So the recording of this lecture will be posted on the AAEM's YouTube page within a week. And it will be available to you guys to review from there as well. And for anybody who couldn't attend today, again, I love the engagement that we had here, and especially the book recommendations and all of the advice in the chat. Thank you all very much. Thank you, Dr. Brown, Dr. Moreno, Dr. Mistal, Dr. Stefanos. Thank you all very, very much for your expertise in all of your fields. I will leave you all there.
thank you, Dr. Bottenhager.
Thank you for organizing this, and thank you to all the people who attended for everything that you do every day for our patients and your colleagues. AAEM appreciates you.
Thank you again, Neha, for asking me to be a part of this panel. This was wonderful. This was a very, very, very engaging, exciting panel. I hope we can do something very similar again. And I was impacted just by seeing all the faces and just hearing everything and reading the chat. This was very, very empowering. So thank you for creating this space.